Here's your host for this morning's edition of America's Fabric.
Good morning. I'm Dr. Elizabeth Lee Vliet. I am an independent physician in private medical practice in Tucson and Dallas, the author of several health books for consumers, and the founder of a new international medical consulting company to help patients have access to quality medical services and medical privacy at lower cost in a variety of countries. My medical websites are www.internationalhealthstrategiesltd.com and www.herplace.com. As we start today, America's Fabric is no longer a 501c3 program, having been denied the 501c3 renewal in the recent IRS targeting of conservative voices. The show is now the free expression of opinions by its host, without the censorship required to retain IRS 501c3 status. We will continue to show how today's events conflict with the founding principles of our great country. But in discussing these issues, we will now be free to use the sometimes political terms that are commonly used in the media today. America's Fabric is now a free market enterprise. Although the hosts are volunteering their time to prepare these shows, there are costs to keeping the show on the air. So if you would like to see these programs continue, please send a contribution to the address mentioned at the end of today's show. Today, I will talk about recent events that combine to push us further down the road to government-controlled medical care by undermining the ability of private medical insurance plans to remain in business. On July 3rd, prior to our independence celebration, while most Americans were abandoning their offices in anticipation of a long holiday weekend, the Obama administration quietly made a holiday news dump in an important announcement when it declared it would delay by 1 year the enforcement of the employer mandate provision of Obamacare, which forces large employers to provide affordable health care for their employees or else pay a significant penalty, about $2,000 per worker. Sounds like good news, right? Businesses were initially relieved. But Obamacare, as signed into law, unequivocally requires this mandate to take effect on January 1, 2014. Since this change was made by the executive office with no input from Congress, it clearly violates the law. Unilaterally eliminating one provision of the law affecting business while keeping the individual mandate in place seems strange. Why would a president who's been so hostile to business up until now suddenly decide to grant a reprieve? Some mainstream media outlets cite the complexity of the law and the need for more time to meet its requirements. Others spun the delay as a deliberate favor to big business that have been dreading the arrival of the mandate. Still others described it as political cover for Democrats in the 2014 midterm elections because they don't want to face voters opposed to Obamacare. While each explanation may contain a grain of truth, there's much more to the story, as I will explain today. Obamacare is a hodgepodge of new regulations, requirements, and penalties and terms that many people are confused by. I'd like to start by defining 3 or 4 terms that will be more and more a part of our everyday vocabulary as Obamacare continues to control health care. First, healthcare exchanges are the basket of qualified insurance policies that meet the new healthcare law requirements for expanded coverage. These may be set up by the states or by the federal government. Many states are refusing to set up the exchanges because of their high cost and fears that they will bankrupt states. The exchanges are supposed to be fully operational by October 1, 2013, but the government is having so much difficulty getting them operational that it will likely be a chaotic mess that further disrupts access to medical care. More on this later in the show. The Medicaid expansion. This is the new buzzword for single-payer health care, which was the new buzzword for public option, which in turn was the buzzword for government-run, government-controlled medical care along the lines of Canada and Britain. The individual mandate requires that individuals purchase health insurance that meets the new expanded federal requirements for coverage that policies have to have. Individuals who do not comply face a financial penalty, initially $95 a year. Guess what people are going to choose? Instead of paying higher premiums, they're going to pay the penalty, in all likelihood. Individuals whose income is below the minimum levels will be eligible for taxpayer-funded subsidies to buy health insurance. The individual mandate was not delayed and starts January 1, 2014. The employer mandate requires that businesses with more than 50 full-time employees, i.e., working more than 30 hours a week, must provide health insurance for all employees, and that insurance must meet the new standards for expanded coverage set forth in the new law. Businesses that do not comply pay a financial penalty, about $2,000 for each employee. For large companies, this clearly runs into the millions of dollars every year. This is the piece of Obamacare that has been delayed by 1 year. Selective enforcement of the Obamacare law violates the law. So why do it? Why delay one component of Obamacare and not the others? More specifically, why delay the employer mandate but not the individual mandate? It doesn't make sense unless you understand the hidden agenda. Obama wants a single-payer, government-controlled healthcare system in the United States. This is not a secret. It is not my personal opinion. Listen to what he himself has said before running for president. Barack Obama, 2003, quote, "I happen to be a proponent of single-payer healthcare system for America. But as all of you know, we may not get there immediately," end quote. Barack Obama, 2007, quote, "But I don't think we'll be able to eliminate employer-based coverage immediately. There's going to be some transition time," end quote. These quotes are not taken out of context. Anyone who's been paying attention knows that transitioning to a single-payer, government-controlled healthcare system has been Obama's goal all along with most Democrats. Here are quotes from his supporters who want to control healthcare delivery. Representative Jan Schakowsky, Democrat, Illinois, 2009, quote, "Next to me was a guy from the insurance company who then argued against the public opinion. He said it would not let private insurance companies compete. A public option would put the private insurance companies out of business and lead to single payer. My single payer friends, he was right. The man was right," end quote. Here, Representative Schakowsky shows how the public option, now called Medicaid expansion, will lead their desired goal of single-payer, government-controlled healthcare system into existence. And then Jacob S. Hacker, a Yale professor, said in 2008, quote, "Someone once said to me, this is a Trojan horse for single-payer. It's not a Trojan horse, right? It's right there. I am telling you, we are going to get there. Over time, slowly, but we are going to move away from reliance on employer-based health insurance. But we will do it in a way that we're not going to frighten people into thinking they're going to lose their private insurance. We will give them a choice of public or private insurance when they are in the pool. We are going to let them keep their private insurance as long as their employer continues to provide it. End quote. Let them keep private insurance? How incredibly arrogant. How do the power elites get the right to decide what you and I purchase for our personal needs? Now, they're deviously setting up ways to get employers to stop offering private insurance. Hacker bluntly sums up the hidden agenda of Obamacare: not to increase competition or patient choice, but to drive people out of private insurance as a stepping stone to a government-run single-payer system. The employer mandate delay is a sly stepping stone to single-payer, government-run health care. And since the public has clearly and consistently opposed government-run health care, the terms have been changed to confuse you. The buzzword has been named Medicaid expansion to serve the public relations purpose of confusing the public and avoiding calling taxpayer-funded, government-controlled health care single-payer or public option. We know from his own words that Obama's goal is government-run health care. So the purpose behind the delay of the employer mandate seems clear. Hurry up the transition time away from employer-based insurance to a single-payer government-controlled system. How? By forcing individuals to purchase compliant health care plans, but not forcing employers to provide those plans. Obama is creating a swell of 10 to 13 million workers who must enroll in health insurance but cannot obtain it from their employers. These workers have no choice but to use the government-controlled health insurance exchanges or pay a financial penalty. This represents now a doubling of the numbers of workers nationally forced to get health insurance on the chaotic federal insurance exchanges. The IRS has ruled that if workers do have access to affordable health insurance through their employer, their dependents are not eligible for the taxpayer-funded subsidies on the health insurance exchanges. But now, because of this sly trick of delaying the employer mandate, businesses are not required to offer health insurance until 2015. So that means workers plus all their dependents will be eligible for taxpayer-funded subsidies to purchase health insurance on the exchanges. Suddenly, with one hidden trick, the Obama administration has foisted far more cost onto taxpayers. It will estimate cost an additional $60 billion in 2014 alone to cover the increased cost of the subsidies and the loss of revenues from employer penalties. The taxpayers are on the hook for an additional $60 billion in 2014 because of this employer mandate delay. And this $60 billion figure is before we take into account the liar subsidies that will invariably occur now that the administration also quietly removed eligibility verification for taxpayer-funded subsidies. Community organizers are already being hired around the country to sign people up for the health exchanges. There are no penalties if they fail to verify eligibility. and no penalties for signing up people who can't afford the monthly insurance premiums. It is a setup for disaster, much like the liar loans that helped topple the mortgage industry when people were not required to verify income to qualify for a mortgage. All of these added costs now shifted onto the backs of taxpayers are on top of the burdensome cost Obamacare has already created. Studies have projected that private insurance premiums will rise between 20 to 60% in 2014, and some as much as 100%. Jeff Smith from Seattle wrote in the Wall Street Journal Letters, June 12, 2013, quote, "I was going to leave my job and start a business until I shopped around for a health care plan. At Group Health, a health maintenance organization in Seattle, I was given a quote of $842 a month for me and my family. But that would increase to $2,320 starting in January 2014 when Obamacare kicks in. A 276% increase. Why? Because I would be forced to carry coverage I don't want and don't need, such as maternity care. Welcome to the world of socialized medicine, courtesy of the Unaffordable Care Act." End quote. How long will the private insurance market survive with such exploding costs to meet the Obamacare requirements? People will not be able to afford such massive premium increases. That seems to be the whole point. Number one, drive up costs and drive everyone into the arms of government-controlled medical care. It's a quick road to single payer. First, get employers to drop expensive coverage at work because it costs too much. And second, make private insurance too expensive for people to buy on their own. Voila! Sugar Daddy Uncle Sam rushes in to save the day and provide free health care on the backs of taxpayers. Meanwhile, private insurance plans are driven out of business, so no one will have a choice to buy one, even if they can afford it. So as we look at this impact of the employer mandate delay and the Medicaid expansion, how does all of this affect you and your medical care? The delay in the employer mandate is but one of dozens of negative impacts Obamacare will have on your personal medical services. As an independent physician, I've been discussing these issues with my patients for the last few years, helping them to prepare for what's ahead. Here are the 10 most important points that I tell my patients. Number one, your private insurance premiums will cost more and more every year. Number two, you will lose the choices and flexibility in health insurance policies that we have had available until now. Number three, as reimbursements continue to drop, fewer and fewer doctors will take Medicare for those over 65 or Medicaid for people younger than 65. Fewer doctors accepting Medicare and Medicaid causes an increase in wait times for appointments and decreases the numbers and types of specialists available. Consumers had better start lining up their doctors now. Number five, the Medicaid expansion hurts patients. Studies from across the country, various organizations in various states, including a recent one from Oregon, have consistently shown that Medicaid recipients have longer waits for medical care, fewer options for specialists, poorer medical outcomes, and die sooner after surgeries than people with no health insurance at all. Yet an increasing number of Americans under the Medicaid expansion will be forced into this second-class medical care. As more and more people enter the taxpayer-funded plans, Medicare and Medicaid, instead of paying for private insurance, the cost to provide this increased medical care will escalate, leading to higher taxes. And then, with no eligibility verifications in place, millions of people who are in the U.S. illegally will be able to access taxpayer-funded medical services, making longer lines, longer wait times, and less money available for medical care for American citizens, unless taxes are increased even more. Higher expenditures, point 8, to provide medical services lead to rationing of medical care and treatment options to reduce cost. This is the mandated function of the Independent Payment Advisory Board. Cut cost by deciding which types of medical services to allow or disallow. If you're denied treatment, you have no appeal. You're simply out of luck and possibly out of life. This is a radical departure from the appeals process required for all private health insurance plans. Further, the IPAB is accountable only to President Obama and cannot be overridden by Congress or by the courts. IPAB is designed to have the final word on your health. Number 9, under current regulations, if medical care is denied by Medicare, then a patient is not allowed to pay cash to a Medicare-contracted physician or hospital or other health professional. Patients who need medical care that is denied under Medicare or Medicaid will find themselves either 1, having to look for an independent physician or hospital, becoming quite rare these days, or 2, go outside of the U.S. for treatment. And number 10, expect a loss of medical privacy. Beginning in 2014, if you participate in government health insurance, your health records will be sent to a centralized federal database with or without your consent. As if it weren't wildly unpopular enough, we now learn that Obamacare will include a massive data mining operation empowering the Department of Health and Human Services to collect vast amounts of personal information via the IRS, the Veterans Administration, the Defense Department, and the Social Security Administration. Your personal medical information will be placed in the hands of a group of patient navigators who will assist Obamacare enrollees in the states that have not set up their own exchanges. They get little training, 30 hours or less. They need not have any prior experience in health insurance or health care fields to apply. And the HHS has no plans to even administer background checks, unlike private employers who are required to use E-Verify. HHS plans to rush some of these people into the field before training is completed. Lack of background checks, lack of training, and access to your personal Social Security number, your identifying information, and financial information. This is set up for identity theft and worse. If Obamacare's miserable track record to date and the recent NSA and IRS scandals are any indication, we're in for a real disaster. This is an administration out of control, ignoring Supreme Court decisions they don't like, and we are stuck with politicians and the media that are refusing to carry out their constitutional roles as a watchdog. Is it any wonder that 60% of the American public is opposed to this rogue government now having control over our medical care? This is Dr. Vliet signing off for today.
You've been listening to America's Fabric, a radio series on American history and culture, broadcast every Sunday over KVOI Tucson and its affiliates. Be sure to tune in again next Sunday morning at 8. Until then, never forget, it's the courage, knowledge, hard work, and respect for truth of Americans that keeps America free and prosperous. America's Fabric is listener-supported. To make a contribution, send a check to America's Fabric, Post Office Box 17356, Tucson, Arizona, 85731. That's P.O. Box 17356, Tucson, 85731. Every contributor will be mailed a Grateful to be an American bumper sticker. To get more information on America's Fabric or to listen to previous broadcasts, go to americasfabric.com. That's americasfabric.com.